About a year ago, I was talking to one of my friends about the slew of studies showing really broad benefits of the GLP-1 receptor agonists like Ozempic. There was the weight loss, of course, and the improvements in diabetic control, but studies also showed better heart health, kidney health, improved overall mortality. Some analyses showed reductions in problem drinking, smoking, even compulsive shopping among people taking those drugs. I told my friend that I thought these drugs were complete game changers, fundamentally anti-consumption agents that are the cure for society's primary ill of overconsumption. Yeah, but what about the side effects, he said. And I said, sure, there's some GI issues that come up, but usually it's not that bad. Still, I demurred. It's early days. Maybe after 10 years on the drugs, your eyes fall out or something. This week, a study that doesn't suggest that GLP-1s cause your eyes to fall out exactly, but as you'll see in a second, it's not that far off. We are talking about this study appearing in JAMA Network Open, which looks at eye problems in people taking the two most potent GLP-1 drugs, semaglutide, Ozempic, and tirzepatide, Mounjaro. This was a huge retrospective cohort study using the Trinetics database, which contains electronic health record data on millions of patients across the US. Researchers identified over 1 million individuals with diabetes in the database who had no history of eye disease. They then identified when they were first prescribed Ozempic, Mounjaro, or a bunch of non-GLP-1 diabetes medications like insulin and metformin, which serve as controls here. They were on the lookout for conditions which some smaller studies had suggested might be associated with the weight loss drugs, disorders of the optic nerve. In particular, a rather rare condition that can occur even outside diabetes called non-arteritic anterior ischemic optic neuropathy, or NAON. This is a syndrome caused by a decrease in blood supply to the optic nerve and is characterized by the sudden and painless loss of eyesight in one eye and can lead to permanent blindness. It seems straightforward to ask which group, those who got the GLP-1 drugs or those who got other diabetes drugs, had more eye problems, but you probably suspect that these two groups weren't exactly comparable even before they got the drug. People getting the weight loss drugs were younger, more likely to be female, more likely to be on antihypertensive drugs, more likely to have a history of sleep apnea, and much more likely to have obesity. This is a classic apples versus oranges problem in observational research, one that was overcome, in this case, through a form of statistical wizardry called propensity score matching. This is a process which assigns each patient a likelihood of being prescribed the weight loss drugs and then matching two people with similar propensities together where one of the pair actually got the drug and the other didn't. Now, naturally, not everyone gets matched, and these apples and oranges that are just too appley or orangey get dropped from further analysis. After matching, the two groups were much more similar, as you can see here. Now that we have two similar groups, a bunch of orangish apples and a bunch of appley oranges, we can go ahead and compare the rates of NAON between them. Of 79,699 individuals started on either Ozempic or Mounjaro, 35 developed NAON in about 2 years of follow-up. Of 79,699 started on non-GLP-1 diabetic drugs, 19 developed NAON over a similar duration of follow-up. That's 0.04% compared to 0.02%. There's a couple of ways to look at this data. On the relative scale, we see nearly a doubling of the risk of this eyesight-threatening disorder among people taking GLP-1 drugs. But on the absolute scale, any given individual's chance of actually getting this disorder is vanishingly small. The rate in the GLP-1 group was 462 per million individuals compared to a baseline rate of about 238 per million individuals. But identifying rare risks like this is still important, especially for drugs that are as widely prescribed as these. Patients and providers need to have this in the back of their heads so that if an unusual eye symptom does develop, everyone can react quickly. It's still not clear how these drugs could cause NAON. It's true that the optic nerve has GLP-1 receptors on it, so this could be a direct drug effect, but the researchers suggest other possibilities as well, including the idea that sudden metabolic changes associated with weight loss or glucose effects from the drugs may change the microenvironment of the eye. I hate to fall back on more research is necessary, but the truth is more research is necessary to figure out how this works and, importantly, who is most at risk. Now, I should, of course, remind you that this study shows us correlation, not causation. Even with propensity score matching, there will still be differences between the comparison groups that aren't fully accounted for. Beyond that, the very fact that people may be on alert for eye disorders among those taking GLP-1s may become something of a self-fulfilling prophecy in a study like this. If physicians are primed to think of a rare diagnosis like NAION when they see a patient on a GLP-1 drug, they might be more likely to make the diagnosis than they would if presented with exactly the same symptoms in someone not taking the drug. When the outcome is rare like this, minor biases can drive the results. So I'm not ready to go back on my statement that these drugs are game changers. They clearly are, but we'd be naive to assume that there wouldn't be some risk. I'm encouraged that this particular risk is not nearly of a magnitude and frequency to counteract the obvious benefits. In the end, this is one of those knowledge is power things. I don't think we'll see enthusiasm dampen for the GLP-1 drugs because of NAION, but it doesn't hurt for any of us, patients or providers, to be aware of it. For Medscape, I'm Perry Wilson.